The birth of cosmetic botulinum toxin injections. Procedures and products that make us look and feel beautiful are not new concepts. In 4000 BC, Cleopatra would bathe in donkey milk, which contains lactic acid, an ingredient still popular in modern skincare for its exfoliating properties. She also needed around 700 donkeys to provide her with enough milk for her baths. And in 300 BC, the Greeks used a mix of honey and crushed rose petals as face masks, as honey was believed to have antibacterial properties, while rose petals were used for their soothing and aromatic qualities. We still use those two ingredients today. But how did a deadly poison, today called botulinum toxin, become one of the most desirable injectable cosmetic treatments today? Our story begins in early 19th century Germany. Justinus Kerner, a German physician, notices strange symptomatic outbreaks after consumption of smoked sausage, such as muscle weakness and vision issues. Kerner is attributed to linking these symptoms to a potential cause, which he believed to be a toxin. He then predicted that since the toxin causes specific symptoms, such as muscle weakness, then the toxin also had the potential to treat hyperkinetic movement disorders and other medical conditions. Picture him as the Sherlock Holmes of toxins, piecing together clues about muscle weakness and the potential cause from smoked sausage. Who would have thought? Well, he did. And then, on December 14, 1897, a group of 34 Belgian musicians were playing at a funeral and fell ill after eating smoked ham, with other symptoms similar to what Kerner had previously related to a toxin. This illness tragically led to 3 of the musicians dying. Yikes. The remaining ham and some deceased organs were sent to a university to a professor of bacteriology, Dr. Emil van Ermengem, who found the responsible agent, bacteria called Clostridium botulinum. This bacteria releases a dangerous protein called botulinum toxin. Botulism symptoms include difficulty breathing, muscle paralysis, and other undesired symptoms. And what did the doctor name this responsible agent? He named it Bacillus botulinum, after the Latin word of botulus, which is sausage. This sausage toxin would then be isolated and purified by Edward Shantz in 1946. And in 1965, the effects of the toxin injected into the muscles of chicks were studied, in which it demonstrated paralysis and atrophy of the chick's muscles. Sorry, chicks. Next, an ophthalmologist named Dr. Alan Scott investigated this muscle-paralyzing toxin further for the treatment of strabismus, also known as cross-eyed, which is a vision problem that occurs when the muscles around the eye don't work properly to control the eye movement. His aim? To weaken the extraocular eye muscles in patients with strabismus to control their eye movement as an alternative to muscle surgery. Dr. Scott's pioneering work led to FDA approval for human research in 1970s, and eventually he created the injectable toxin oculinum, a precursor to the now famous Botox. He approached multiple companies to manufacture the drug, but had a hard time because the companies only saw high risk and a limited market, which we now know is a billion-dollar mistake. In 1989, FDA approved the toxin for the treatment of the medical conditions strabismus, blepharospasms, which are muscles around the eye that twitch, and hemifacial spasms. Finally, a company known as Allergan agreed to manufacture the drug, and it was eventually rebranded as Botox. The first cosmetic implications was by Dr. Jean Carruthers, in which neurotoxin was studied for the treatment of frown lines in the glabella region, which is also known as the 11 lines between the eyebrows. This led to the FDA approval for Botox for the treatment of frown lines. Dr. Carruthers' work sparked a cosmetic revolution, with other companies soon joining the race to create FDA-approved neurotoxin for different facial areas. As the aesthetic indications were a hot trend, medical indications such as hyperhidrosis, migraines, hyperactive bladder, and others continued to be approved. So fast forward to today. Not all areas of the face where providers inject botulinum toxin are FDA approved. Areas that are approved we call on-label, and areas that are not approved we call off-label. It could cost companies millions of dollars and years of study to obtain one FDA indication for an area. This is a driving factor why many companies only obtain one or a few on-label indications so they can launch their product into market and make money. Additionally, each indication that is FDA approved comes with specific education, such as placement, dosage range, and the way you need to prepare it, to name a few. With the ever-changing aesthetic specialty and increasing knowledge of diverse facial movement, we understand that beauty is personal, and every patient may require unique placement and dosage of neurotoxin to treat their specific muscle movement patterns. These early contributions to botulinum toxin injections for cosmetic purposes are the building blocks to our continued research today. There will continue to be more botulinum toxin products coming to market with nuances, such as quicker acting, some lasting longer, or maybe even needleless. The U.S. facial injectable market size was $4.25 billion in 2023 and projected to reach around $12.40 billion by 2033. And if that's not a hot trending market, I don't know what is. And while there are many cosmetic procedures out there, there are roughly 4,500 peer-reviewed articles for the neurotoxin Botox, which speaks to the safety profile of the drug, in addition to studies which show potential use cases, such as for depression. With an increasing demand for these treatments, your skills will give patients confidence time and time again, and you have the power to make an impact on how your community looks and feels. Welcome to the start of your new favorite skill.